Acute myocardial infarction.
The heart is a hollow muscular organ that pumps blood for circulation to all parts of the body. The coronary arteries branch off the aorta and are located on the surface of the heart. They deliver oxygen-rich blood to the heart muscle. There are two major coronary arteries, the right and the left. The left splits into two arteries, called the circumflex artery, supplying the left and posterior sides of the heart, and the left anterior descending artery, supplying the front of the heart. The right supplies the posterior side of the heart. Atherosclerosis, cellular waste products, calcium, and other substances, which may build up in the inner lining of the coronary artery, resulting in plaque formation. Atherosclerosis produces an area in the vessel wall, which may act as a focus for atherosclerotic events.
In these videos, explain that atherosclerosis is the principal cause of myocardial infarction. Myocardial acute infarction is a medical term for an event commonly known as heart attack. It happens when blood stops flowing properly to part of the heart and the heart muscle is injured due not to receiving enough oxygen. Usually, this is because one of the coronary arteries that supplies blood to the heart develops a blockage due to an unstable buildup of white blood cells, cholesterol, and fat. Chest pain that is felt behind the breast bone and sometimes travel to the left arm or the left side of the neck. Additionally, the person may have shortness of breath, sweating, nausea, vomiting, abnormal heartbeats, and anxiety. Risk factors of an infarction: previous cardiovascular disease, old age, tobacco smoking, high blood levels of certain lipids, low levels of high-density lipoprotein, cholesterol, diabetes, and high blood pressure, lack of physical activity, obesity, and excessive alcohol consumption. The main way to determine if a person has a myocardial infarction are electrocardiograms.
An acute myocardial infarction due to a ruptured plaque creating thrombosis of the proximal segment of the left anterior descending artery. Our current approach for patients with ST segment elevation myocardial infarction is immediate cardiac catheterization and percutaneous intervention. Balloon dilatation is first performed. Dissolution of the thrombus results in distal microembolization. Occlusion of the distal microvascular circulation increases myocardial injury, which may be reflected in further increased myocardial enzyme levels and additional myocardial damage. Following balloon dilatation, a long atherothrombotic lesion remains. Stent placement compresses the residual clot under the stent struts and causes a cheese grater effect. This results in an additional thrombotic embolization. Due to the apparent long length of the lesion, a second stent is placed. Placement of this stent also causes some distal embolization. Although the angiographic result is quite acceptable, a significant amount of residual thrombus persists.
This is a procedure to dissolve the thrombus caused by the atheroma plaque. Treatment. Immediate treatments for a suspected infarction of myocardium include aspirin, sometimes nitroglycerin to treat chest pain and oxygen. STEMI is treated by restoring circulation to the heart, called reperfusion therapy, and typical methods are angioplasty, where the arteries are pushed open, and thrombolysis, like I explained in the video before, where the blockage is removed using medications. Ischemic heart disease includes myocardial infarction, angina, and heart failure when it happens after an infarction was the leading cause of death for both men and women worldwide in 211.
When an atheromatous plaque ruptures in a coronary vessel, and the clot
This
which
is a
forms completely
physiopathology of an atheroma plaque.
obliterates the vascular lumen. Complete occlusion of the artery which supplies the lateral wall of the left ventricle. Ours spreads outwards in a wave of cell death, which may ultimately involve the full thickness of that region of the myocardial wall, that the occluded vessel.
But John has never experienced pain from his heart before. To him, it feels just like indigestion.
Symptoms of a myocardial infarction.
Perhaps the old man better off in go.
He has no idea that this is the start of a heart attack. The growing John's indigestion is getting worse. For the first time in his life, the regular beat of John's heart is under threat. A patch of 4 billion muscle cells is running low on oxygen.
John, what's up? What's the matter?
5 minutes after his heart attack began, John's body is struggling to deal with the crisis. His brain has triggered a surge of the hormone adrenaline into his bloodstream. This is one of the most primitive and powerful reactions in the human body. Adrenaline arrives in his heart and soaks into a starving muscle.
Call an ambulance.
But adrenaline can do nothing about the growing clot, which fills 90% of his artery. Best of his heart to take up the slack. John's weakened heart cannot sustain its beat much longer.
How's the pain now, John? Okay. He loves football, John.
It's now 50.
That'll be okay, John. Just hang on.
John's injured heart is wearing itself out. Its beat is getting weaker. The effects are beginning to tell on the rest of his body and out of his blood into the air.
And fat-like substances. In this condition, the most common types of lipids are cholesterol and triglycerides.